Good morning, everybody. Can I again thank nearly 63,000 people that came forward to get testing, and I really want to say a big thank you to those living in the Fairfield local government area. We have noticed a significant increase in testing in that community, and today in particular we want to encourage people living in the Canterbury Bankstown local government area to please come forward and get tested, and also those living around Hurstville and Kogarah in particular. And Dr. Kerry Chant will specifically read out a list of suburbs where we do want people to come forward and get testing. The good news is we're picking up extra cases, not just with those who have symptoms, but through the testing we're doing of people working and going out of the area has picked up a number of cases for people who aren't symptomatic. And that is a really important message. If you're living in a community that has a lot of cases, even if you don't have symptoms, don't assume you don't have the virus. Because in communities where the virus is lurking, where the virus is circulating, you could have the virus, not know it, and unfortunately take it home and give it to your loved ones. We don't want to see that distress caused in families and your closest people. So please make sure that you listen to our messages regarding testing. Thank you to those of you who have been. It's been outstanding, and we really need to keep up that effort. To the 24 hours to 8 p.m. last night, we had 78 cases of community transmission. So it's always pleasing when you see a drop in those numbers, but we still had about 27 people who are infectious in the community out of those cases, and that's the number we really want to bring down. Again, the main place where people are unfortunately either getting the virus or giving the virus is in workplaces. And that's why we had to take some of those difficult decisions we had to. We're still seeing a number of cases coming all across Greater Sydney, not just in those 3 LGAs that we've highlighted. But then unfortunately people unknowingly might get the virus and then take it home to their families. And if you have a large family in the household, because of how contagious this virus is, it really means everybody in that household is going to get it. And what we're also seeing is younger people getting it because of that phenomena. And I just want to really stress to people, all of us have to be on our guard. We know there are various venues of concern all throughout Greater Sydney, but in particular those 3 local government areas are still representing more than 2/3 of all the cases, and that's why the focus remains in those communities. Can I also please give a shout out to everybody working in Service New South Wales. Yesterday, whilst the system had some challenges in the morning, by the end of the day, nearly 6,000 businesses had their applications processed for support. And my message here is, please do not undergo any additional stress to what you're already going through. There is assistance for businesses. Go to Service New South Wales, and if you're an individual worker who wants that help and that support, please go to Services Australia. We're making sure that on the Services New South Wales website all that information is available. You can ring up and get information. You can still go into a Service New South Wales centre as well, although we're trying to reduce mobility and we do prefer people to ring or check up online. But if you must go in, you can, but make sure you're COVID safe. And we just want to encourage everybody to make sure they're aware of what assistance they can have and what support they can have to support them during this time. Now, I'm convinced that if all of us work together and focus on those key areas that are of concern, namely workplaces and households where the transmission is happening or the virus is spreading, we will get through this. And I just want to stress to everybody, no matter what you do and where you live, if you must go to work, please make sure you think about your situation. Have you been tested? If you have symptoms, you shouldn't be going to work. And if you don't have symptoms and you live in the Fairfield area in particular, make sure you get tested every 3 days before you go to work. That is really providing enormous benefits to us in capturing cases which otherwise may have been undetected, and we're very, very grateful that that's occurring. But all of us have to focus on workplaces and our households. That's the 2 main areas of concern and why the government had to take those additional difficult decisions last week. And we are hoping that by the end of this week we certainly see the benefit of those more difficult decisions. But I do want to stress that the government is also working very hard with our communities to make sure people can go back to work safely after July 30, and we will be having more to say about that in the coming days. But in the meantime, thank you everybody for your efforts. It is making a difference. That 78 number would have been much, much higher had people not been doing the right thing. and we just need everybody to stick with it, to make sure that you protect you and your family and your work colleagues in particular. And please know that from tomorrow there are harsh penalties in place for employers forcing their employees into the work sites unless they're absolutely necessary. And that's really an important tool for us to make sure that employees aren't forced out of their homes if they can safely do their work from home. Dr Chant will now give an update, and then Deputy Commissioner Warboys, and then we'll take any questions. Thank you.
So New South Wales recorded 78 locally acquired cases of COVID in the 24 hours to 8 p.m. last night, and one new case was acquired overseas in the 24 hours to 8 p.m. last night. Tragically, there has been a death of a woman in her 50s who was confirmed COVID case. She was a resident in southwestern Sydney and a close contact of a COVID-19 case, and can I just extend my sympathies to her, her family and her friends at this most difficult time. I think this now leads me to my segue to the fact that COVID is a very serious disease. We are seeing more hospitalisations, more admissions to ICU, more people on ventilators. We have to stop the spread of COVID. To do this, we all need to work together. We need to limit our movements. We need to consider whenever we leave our house that anyone with us, anyone we come into contact with, could convey the virus. So whilst it is in human nature to engage in conversation with others, to be friendly, unfortunately, this is not the time to do that. So even if you run into your next door neighbour in the shopping centre, in the Coles, whilst you're at Coles or Woolworths or Aldi or any other grocery shop, don't start up a conversation. Now is the time for minimising your interactions with others. Even if you've got a mask, do not think that affords total protection. We want to be absolutely sure that as we go about our daily lives, we do not come into contact with anyone else that would pose a risk. Obviously, there are essential work. There is work, and I shouldn't use that term essential. I understand that work is essential to everyone, and probably need a new word other than essential. But I think the community understands what we mean. We need to maintain our food services, logistics supply. We need hospitals and health services to be operating. But now is the time to really ensure that everyone complies with the spirit and intent. And the spirit and intent of the public health orders is to reduce mobility, reduce the opportunities for anyone to come into contact with anyone else. And so that responsibility is now firmly on workplaces to take those actions, and clearly we have seen the closure of a number of workplaces which facilitates that as well. There are some areas of increased concern. So in terms of my assessment of the situation at the moment, is we still see cases in the Fairfield local government area, and can I just thank that community. I had the opportunity to review the testing numbers today, and that community has responded, so thank you. But unfortunately, we have to continue to sustain those high testing rates in that community and continue to practice those COVID-safe behaviours of staying at home, not visiting friends and family. I am concerned about the emerging risk in Canterbury, Bankstown local government area, so that covers Belmore, Lakemba, Punchbowl and Yagoona. And my reason is that there are a number of cases there, and there's also a number of exposure sites in that area. Also, I can confirm today that one new case was linked to the Al Sultan butchery in Lakemba, and it's included in today's numbers. So again, please be aware if you've been to that butcher, the Al Sultan butchery, please make sure that you follow the public health advice, urgently get tested and isolate, as well as your household members. The other areas that we have seen cases demonstrating we've got missing links. So we're finding unlinked cases in other areas, and that means that there's chains of transmission where you're yet to crack and yet to break. That engenders quite significant concern to me. So also areas around Hurstville and Kogarah, Maryland's, Greystanes, Auburn, Guildford, Mount Druitt and Rooty Hill. I would also like to update you on the data in relation to the testing capacity. It's been pleasing to see those high rates of testing sustained, and we are working with the private pathology to ensure that those turnaround times and the throughput are maintained. And finally, another action I want to make it clear is permitted under these lockdown provisions is going out and getting a vaccine. You shouldn't go if you're a close contact or you've been designated as a casual contact, but please go and get vaccinated. There is access to vaccines, and the vaccines are incredibly effective at preventing hospitalisation and death, and they are the way out. And yes, we haven't got enough vaccine at the moment, but we have got some vaccine which is accessible, and I would urge everyone to go forward for your second dose of AstraZeneca, or also your first dose, or if you're eligible for Pfizer, to take up that opportunity. Thank you.
Thanks, Kerry. I just want to stress the message in regard to vaccinations. Clearly, we continue to see in the public arena messages coming out from some people who would describe themselves as anti-vaxxers, and others who have, for various reasons, opposition to vaccination. Can I just stress that anti-vaxxers obviously live in another universe, and others who give messages that this virus isn't dangerous and don't get vaccinated clearly have no medical or scientific training. This virus is an extremely transmissible virus. It can kill you, and it can kill your family and your friends. We've just heard from Dr. Chant that the number of people now going into our hospitals in New South Wales are increasing. The number of people going into our intensive care units are increasing, and the number of people being ventilated are increasing. And sadly, so are the deaths. So my message is very strongly that to the community more broadly, there is only one solution here, and that is to get vaccinated. Dismiss the ideas that aren't based in science or medicine or are propagated by anti-vaxxers who live in another universe. Book yourself in for a vaccination. We have quite a large number of vaccination sites now available through the state health system, but we also have GPs who are providing vaccines. We've talked many times about the fact that obviously there are some limits on the amount of vaccine coming through from the federal government at the moment, but they are trying hard to get more vaccine. What we do know is that they have now brought online more GPs to be able to distribute the vaccine. That means that you have the capacity to hopefully ring a GP in your area, preferably your own GP. If your GP is not vaccinating for whatever reason, ask your GP for a referral and advice to go to another GP in the local area and get your vaccine. There is no question that we will not get out of this pandemic without a very substantial proportion of our population being vaccinated. So please go and get vaccinated. Don't listen to some of these crazy messages that are coming out implying that this is not a dangerous virus. It's extremely dangerous.
Thank you, Minister. Good morning, Premier. Dr. Chan. 160 penalty infringement notices issued in the last 24 hours, and be rest assured that these notices are issued to people who have absolutely no regard for the health orders or safety in the public space. A couple of examples are a group of people who were spoken to at George Street in an office suite. Police were walking along. They found a gentleman outside of that, a young man. He took him into an office suite where clearly there had been a party with 6 other people, 7 people in a small office suite, birthday cake, alcoholic drinks, birthday food, and a person passed out on the floor. No evidence of any mask wearing, no good reason to be in that office suite, no good reason to have a party. 7 infringement notices issued and those people directed back to their residences where they actually live. A really, really good example, again, of where Crime Stoppers, New South Wales Police will take action where people clearly breach public health orders. Another example was a man that went into Bondi Police Station with a fairly frivolous excuse to be there. He was directed to return to his home in Merrylands. He chose to stand outside then and wait for a lift, which apparently never arrived. Police again asked him to move back to Merrylands, more than 30 kilometres away. That person was then later found on the gym equipment down at Bondi, where he ran from police. Police grabbed that man, spoke to him and issued him with a penalty notice for $1,000 for breaching the public health order. Just two examples of the 160 notices that are issued that should send a very clear message to people that whilst New South Wales Police will always work with people around public safety, around their own safety, that every single day we find people that clearly want to step outside the orders for very selfish reasons, and they put the safety of themselves, the public, at great risk. The other thing that I'd like to highlight today, that we've opened our Regional Emergency Operations Centre at Bass Hill. This is a centre that has government, non-government people in that centre in one space, under one roof, to assist and support the people of South West Sydney, in particular Fairfield. So that has a strong presence with local government and feeds back into state government and Crisis Policy Committee, where we can get the very simplest and easiest of problems sorted at the lowest level. Thank you.
Dr. Chan, are you aware in some instances that it's taking up to 5 days for people to get their test results? And why is it taking so long? Are staff fatigued? Are there not enough staff? What is the current situation?
Look, I want to reassure the community that one of the private labs in particular did have some issues with scale, and you can imagine that it's been a double-edged sword. We're really pleased to see the community response to the testing, and that's part of the strategy. We're working closely with that company, and I note that they've put in a lot of additional measures to call upon other lab capacity in other states, but also up their administrative. And I think in the previous I've also indicated, please patience. I know it's a really difficult time, but we just have to make these sacrifices at this time. This is too critical. So if you are waiting for a test, I know 5 days is a long time, but I can confirm to you that the average time for that pathology company is around 28 hours. So there are outliers, but the average is 28. And I've got to say that many of the other turnaround times are much quicker. We also have a way of prioritising. So again, my message to you, if you've been directed by public health, when you're in the queues, please put your hand up, make yourself known. There should be people walking those queues too and asking you about those issues. If you've got a form that says that, please make sure that you alert yourself so we can fast track those specimens, because obviously close contacts are the highest risk.
Of the outbreak, are contact tracers now completely overwhelmed?
No, contact tracers are not at all overwhelmed. Clearly, we are taking we're very pleased with the fact that we've got the QR system, and the venues that people are being exposed at are venues that are essential. You know, people need to go to supermarkets. It's pleasing to see that people are choosing to go for very short periods of time. As I've indicated, directional, be very purposeful when you're shopping, go with a list, minimise your contact with others when you're there. So we have, for full transparency, and because we want to take a note, we want to just do everything we can, called all those people, either casual or close contacts, depending on the situation. And can I appreciate the cooperation of those individuals? When they get that text and then the follow-up phone call, the fact that they're now isolating, and I think it's very, if I could just draw attention, in the stay-at-home, when you're under stay-at-home instructions, which is now, is that you really can't leave the house unless it's absolutely essential, and those essential things are like food and obviously urgent medical care. But in terms of when you're in isolation, unless it's a medical emergency or for that reason, then you're not permitted to leave. You actually have to be isolating and isolating for everyone else in that household. So I really thank everyone for taking the public health advice and following that public health advice, but I just want to draw that distinction.
Part of the issue with the testing lag is that people have to get a lot of people are having to get a test before they can see a GP for their child or before they can have an operation, and the testing, the delay is meaning that people are having to cancel their appointments. Is that obviously an issue for you?
So a couple of things to reassure the community that anyone who needs urgent care can get urgent care. We have other ways of protecting our staff. Obviously, GPs would be appropriately asking someone with respiratory symptoms to get a COVID test in the current situation where we do have community transmission. I would suggest that individuals if they've got any concerns, contact their GP. If their condition's deteriorating, that they contact their GP and get advice about what the next steps. I think that what we need to recognise is this is a challenging circumstance for everyone. I want to acknowledge the hard work of the GPs and the pharmacists and all of the health professionals in responding, but we do need to have a bit of patience. Everyone is working very hard, but we all need to pull together.
We are hearing from cases have been picked up in the every 3-day surveillance testing. The Premier foreshadowed that. How many are you picking up?
We've actually seen quite an uptick in testing in the Fairfield local government area. It's now pleasing to see that, and we'd like to see that increased in the adjacent Canterbury Bankstown area, certainly around those suburbs I mentioned earlier. We actually have picked up lots of cases where people... I'll see if I can find that and give you an example. But as an example, people are really surprised that they're positive. And that's because of the point I've been making repeatedly. You don't need to have symptoms to be infectious. We've always known that you're infectious for the 48 hours before you have symptoms. And that means that in that period, you're infectious. But what we see with the Delta variant is that you're potentially more infectious than with other variants in that period when you don't have symptoms. So my clear message is, just because you don't have symptoms doesn't mean you're not infectious. And so we need to meet every moment of the day we're going about our business, and that should largely be in our house, therefore exposing no one else. But if we have to go to essential workplace, please follow all the COVID safe practices that have been put in place for those workplaces. It is important that you do not infect others in the workplace. And so there's a range of strategies put in place, such as not having tea rooms, not having collection points, moving outdoors for when you're eating in groups, keeping distance. And this is only for those most essential workplaces. I can't stress this enough. Only the most critical workplaces should be operational, and we are calling upon employers. The Minister has indicated the penalties have increased. But ultimately, this is my plea to employers to please do the right thing. We all have a part to play, and the more we can work together, the more we can see those numbers infectious in the community drop. And again, thank the community of Fairfield who has responded to that testing.
In the workplace, of the cases announced today, what percentage are acquired in the workplace and what percentage in households?
Household transmission continues to dominate, but what you see in workplaces is that when you have a case in a workplace, they're often large settings where you have multiple interactions, but who you're interacting with is people outside your household and social network. You're introducing that infection into other households, and it's almost like you're setting off little fires across the Sydney metropolitan area.
Give us an idea. If there's 78 new cases, how many of those are in the workplace?
I'll get you that information, but there have been a number that have been in the workplace.
Single digits, or?
Oh, I'll get you that. Oh, I don't want to mislead you. I'll get you the information.
Also, Dr. Chan.
Some of those workplaces, construction sites, and is there a chance what Melbourne does with the 25% of sites allowed to open, is that a chance of coming in here?
So the issue is, I am clear that in terms of my health advice, I've provided very clear health advice that we need to decrease mobility and decrease the opportunities for interaction between individuals. We have seen a number of outbreaks in workplaces. Now, some of them are settings where we absolutely need to have just for food and basic necessities. But in other settings, we've seen tradespeople, construction sites impacted. Now, the actual exact time in terms of where the transmission occurred becomes less relevant in terms of the fact that we know that people have carpooled and interacted on those work sites. But what that's led to is cases popping up in a variety of other local government areas. And then what's happened is by the time we've detected those chains of transmission, those individuals themselves have further transmitted to their households. And so you've set off a whole chain of transmission. So can I be clear? My strong advice to government is we need to decrease the movement and the potential interaction and minimise everything in workplaces. I've also advised, which has been my messaging, about deferring non-essential healthcare. So, for instance, in terms of dental, moving to only urgent care situations. So my advice is do everything you can to limit your movements outside the house, and we are expecting workplaces to play their part.
Regional workplaces are in a bit of a flap about sending all their staff home. Can you confirm it's currently a public health order, a directive to work from home, but we understand that could be reversed today?
So my advice, and I'll let the Minister answer that question.
Thanks, Sarah. Now, look, the essential order, there's been obviously some discussion about orders. So let me make it very clear that under the Public Health Act here in New South Wales, orders can be made. Normally, of course, legislation would take months, possibly a year to get developed. But in a fast-moving pandemic situation, which is what the Public Health Act envisages as a possibility, orders can be made and they have the force of law. But obviously, in the rush to try and defeat a virus that is quickly moving, the Parliamentary Council who draft these orders and present them for signing might not get absolute precision on every issue. And that's why I was explaining yesterday that the law is the law. And you hear every day from the Deputy Commissioner about the number of people who have received fines and enforcement because the law is the law. But there might be some areas where there might be some confusion initially because of the fast drafting done in hours instead of months or years. That issue that you're talking about, in regard to the employment aspect, it is very, very clear that in the area that Dr. Chant is primarily concerned about, which is Greater Sydney, obviously concerned about the whole of New South Wales, but Greater Sydney is where she is focused on the essential of reducing mobility, which is why she gave the government certain advice in regard to shutting down construction sites and so on. But one of those issues that was raised at the time was that some employers, particularly in various industries, were insisting that their staff come into the office. So the very clear message which was given obviously was we can't do that, and there'll be a $10,000 fine if you do it. People should be able to work at home. You should encourage them to work at home unless it's really critical. But the instructions to Parliamentary Council were obviously a little confused in regard to the regions. So that's been amended. I personally signed the amending order at 10:44. So people in the regions, I actually had a couple of messages actually from one of the Labor colleagues yesterday afternoon, and I asked the Parliamentary Council and the lawyers to look at it, and it's fixed. So just by way of clarity, just so people know, if you're in the broader area outside Greater Sydney, then obviously you work with your employer and listen to what the employer wants. But there may well be employers there who understand that it's still wise to minimise the number of people in your office. We've had the case just of the people who went up to Orange, and there are issues there that are potential. It's not an immediate danger as it is in particularly parts of Sydney at the moment, but certainly there's a still risk, and I would encourage employers in the regional areas to try and allow your staff to work from home, to again minimise what Dr. Chant keeps highlighting, that transmission within the household is almost guaranteed, and if a member of that household, in other words, if there's one case there, it's almost guaranteed the rest of the family will get it. And then if one of those people go out to work, it goes into another household. So I would still encourage employers to just exercise common sense about it and try and keep us safe as possible in the region.
Premier, on this issue, Premier, on this
Nothing
issue.
else for me?
Minister, on this issue.
Dr. Chant, just to follow up, just in regards to that pathology lab that you mentioned at the beginning, the one that has had some delays, do you know what percentage of tests are going to that lab?
I understand that it probably in excess of about 10,000 tests go to that lab. And certainly, can I just extend my appreciation whilst we're talking about laboratories and the work they're doing? They are taking steps to scale up. And can I express my gratitude to the private pathology labs and the public labs for doing the hard yards as well as the collectors.
The woman in her 50s was in her home. The woman in her 50s, can you explain about her who's died, why she was in the home and not receiving care in hospital?
So that case, I'm not going to go into the details of that case in the specifics, but just to say that family were offered care and were offered transport to alternate facility for also to support them with their isolation and care. They made the decision to stay at home, but the local health district has got a lot of services for managing a large number of people in that area and have got a clinical outreach to care teams. But I think it's important to know, and this is one of the factors I want to just get across to the community. You know, COVID, you can deteriorate quite quickly with COVID. We're not dealing with a mild case of flu where you've got some pre-existing immunity. This is not like that. Now, occasionally we do see that with flu, with rapid deterioration, particularly in young people, but COVID more broadly is a much more severe illness, and you are going to see rapid deteriorations. So it is important that we work with people with COVID to support them with the best possible care we can to ensure their best possible outcome. And I just want to reassure the community that those health services are available and we are here to care for you.
Were health authorities aware that were they aware that the woman had contracted coronavirus, had contracted COVID before she sadly passed?
That is my understanding, and that care was offered and there was care around that family. That is my understanding of the situation.
Premier, in relation to employment and working from home, the health orders say that an employer must require a staff member to work from home, but not if it's not reasonably practicable. Dr. Chant was pleading with the employers to, do the right thing, but is there a way that you could fix the health order so that reasonably practicable isn't something that is decided by the employer but is a bit more clear? People are saying that they're still being forced to go into work even though they think they can work from home.
Well, obviously, we've made it very clear that in the office environment, people who can work safely at home should absolutely be at home. In fact, if an office worker is forced into the workplace, well, then the employer can face hefty fines. And there are always exceptions to people who need to undertake critical work to keep society going. And government can sit there for months and months and still not get the list right. And we want to be very clear about this. In a pandemic, when the Chief Medical Officer gives government very urgent and serious advice about needing to reduce mobility, we need to act. We can't even wait hours or a day. You need to act immediately. And that's why we're saying to everybody, the two biggest risks for getting or transmitting COVID are workplaces or the household. And we cannot stress that enough. That's why we had to make some very difficult decisions based on Dr. Chant's advice. And that advice is to keep as many people inside the home as possible. And obviously there are always exceptions. There are always exceptions to people needing to do critical work to keep all of us going, and we deeply appreciate that. But this is a case and a situation where let's stop focusing on the exceptions and focus on the rules which 99% of us need to follow and 99% of us need to understand and do understand.
Premier, people are saying, we're hearing from people who work in an office, a small office, with only a couple of people. Their boss thinks that it's not reasonably practicable for them to work at home, so the boss can then ask them to come into the office. They don't want to complain to Safe Work because they, fear that they'll get the sack from their boss.
This is the time to make sure that everybody's doing the right thing. This is the time to raise with government officials if people are forcing you to do something you don't want to. And I'm sorry, if you have any examples, please give them to us and we can follow them up.
Can the phrase reasonably practicable be...
Sorry, some people haven't asked the question yet.
Just in relation to construction, is there any likely to be any compromise on that? They're saying again today that they were blindsided by this, that if we took the Victorian approach of 25%, it would save businesses from going under.
Can I say what is really, really important for us with the construction sector is, firstly, we're grateful for the feedback. We understand the impacts it's causing on the broader economy, but we also appreciate this pause is allowing all work sites to get COVID safe. It's making sure that whether you're a subby of a subby, whether you're a major contractor who has subbies of subbies coming from all across Greater Sydney, that when you resume work, you have a safe workplace. And we'll be actually giving the industry plenty of warning before July 30 so that they can resume on the 31st of July. And can I make this very clear? Putting a percentage on there causes more confusion for people. Having to work out what percentage of workers or amount of work you're doing causes confusion. We want to have clear rules of what is COVID safe. And can I thank the Treasurer, the Deputy Premier that are working with the construction sector on a daily basis and with Dr. Chan's public health team to make sure that every business, no matter how large or small, has, especially when it's regarding our mobile workforce, which is going to multiple sites, have COVID safety plans in place so they can resume on the 31st of July. And I want to make that very clear. We're also...
Is that a guarantee?
Yeah.
They already had COVID safe plans.
Guarantee of the 31st, back on the 31st, guaranteed construction?
Look, there'll definitely be construction activity on the 31st of July. I can give you that assurance. And we're also working with the industry, and this is a really important point, to make sure sites are kept what we call live. And the industry uses the term warm, as in making sure there's enough security and that equipment's taken care of so that they can resume as quickly as possible. But what is important is, yes, there were COVID safety plans on paper, but we were finding too many workplaces weren't implementing them, and that's why the risk, all projects, of course including government projects, when you've got hundreds and hundreds of people coming on site, you don't know what your contractors, what subcontracts they have, where those subcontractors are coming from. These are very complex work sites where literally hundreds and hundreds of workers from all across Greater Sydney are coming together. And when there's no oversight and proper testing and proper planning, it's really not a safe environment when you're in the height of an outbreak. And so can I stress this to the sector? Firstly, thank you for your involvement. Thank you for your daily contact with our officials and members of the Cabinet. And please know that we're working with you to get you up and running as soon as possible. And I'm absolutely convinced that on July 31 there will be construction activity.
Shouldn't you be able to...
How much compensation for construction workers to travel to the regions when they can't do the same work in their own backyard? Isn't that putting those communities at risk?
Oh, well, obviously you aren't allowed to go into the regions if you live in particular parts of Greater Sydney. But we're also saying to employers, please make sure, in regions in particular, in regional New South Wales where those activities are still allowed to continue, please make sure you have very stringent COVID safe plans in place, not just on paper, not just when officials turn up to make sure you're doing the right thing, but 100% of the time, so that you do protect your workers, but more importantly, you protect the wider community. I'm sorry, some people haven't asked the question
So
yet.
just on case numbers, obviously you say the number that you're looking at is the number of people who have been infectious in the community, but you also report people who have been in isolation for part of their infectious. Why do you split that number, and what's the difference?
Oh, look, there isn't well, the difference is that sometimes being a day infectious in the community clearly has less of a risk, and it might be a more secure setting. And what the number is that we want to really focus on is when you've been in the community for the entire time of your infectiousness, you are then able to obviously be at higher risk of transferring the virus, and which is why we like to focus on that number. To give a stark example, that at least 27 people in the last 24 hours were infectious in the community for the entire duration of their infectiousness without realising it. If you're infectious in the community for a day, of course that's not a good thing, but at least we know that we got to you early that you were identified as being infectious and you're now at home isolating. So the number we give is trying to be as transparent as possible. And please appreciate, Health gets all the data by 8 p.m. overnight. They give us the breakdowns that they can. So by the time we come to you, we hope to have more concrete information, which allows me to talk about those things. Imagine getting all the case numbers in and then literally health people work through the entire night. And then in the morning, when Minister Hazzard and myself and other members of the team get briefed, we have an indication of those numbers. Now, those numbers will go up and down during the day because there's always cases under investigation. But what we hope to achieve by conveying the information is to allow people to appreciate the context, why we're worried, the parts of the numbers that worry us the most. And there will be a point in time in the future when these numbers won't matter as much. When the vaccination rates are higher, we won't be focusing so much on these numbers. But whilst the virus is lurking in our community undetected, that is a concern, because when you have 27 people who've been infectious for the whole time, what that means is they could literally have started chains of transmission we still don't know about. And that's why when Dr. Chant says reduce your mobility, it means that if anyone is infectious, they might not have symptoms, might not even know anybody with COVID, but they could unintentionally be spreading it every time they leave the house. That's why we're saying no matter what your circumstances are, reduce your mobility. If people stop moving around, the virus stops moving around. And that is the strongest message we can give. We're trying to make sure we're compassionate along the way. We understand people's needs to provide food and services that all of us rely on. But at the same time, it's just a very simple message. Do not leave the house unless you absolutely have to. Reduce your mobility when you do need to leave the house. Think about every step, every action you're taking. Even Dr. Chan's advice today about, as sad as it seems, don't engage in social interaction. Please use your telephones, your home devices to communicate and socialise with people. The harder we work now, the quicker we can get out of this. And that's the strongest message. The harder all of us work now, the quicker we'll get out of this. We are throwing everything at it to get out of this as quickly as possible. And there are green shoots. There are green shoots coming through in terms of the cases and what we're seeing, and also people's understanding of how quickly and when they need to get tested is really helping us. And I just want to thank everybody involved in the process, and again, members of the community in particular who've come forward, heard the messages, and it's very encouraging to know when you're picking up cases and people that don't have symptoms, you know that people are listening and responding, and we are so grateful about that. Because otherwise you would not have picked up those cases had not people, in particular workforces, acknowledge that they need to do that, and we're deeply grateful for that.
People who are already on income support payments like youth allowance and disability payments, they're not eligible for disaster recovery payments, and so they've lost work, and a lot of them are now falling through the cracks. Will your government look at giving greater financial support or another form of grant for those people who are falling through that crack?
Can I make it very clear that if people have had their hours of work reduced or not working, they are eligible for disaster payments.
Not if they're a job seeker.
Yes. Right, obviously if you're on unemployment benefits, well then you get those benefits, but we can simply talk to the Commonwealth about those matters. The Commonwealth provides the criteria for individual payments. We support businesses. That were the arrangements at National Cabinet. So please know that we worked hard to make sure that the amounts of the disaster payments were increased in New South Wales, and in fact we're picking up the tab for people who might not specifically live in a national government defined hotspot area, because we've locked down large swathes of Greater Sydney and the Central Coast and Wollongong. We're making sure that even if you don't fit into the federal government's definition of a hotspot, we're picking up the tab. So we are more than happy to raise some specific issues that have been raised, but please know that any individual who is suffering because they've got less hours or can't sustain their income, please contact Services Australia for that support.
Can you guarantee that no one will lose their job if they complain to Safe Work or to authorities that their employer is making them come into the office because their employer doesn't think that they can, it's reasonably practicable for them to work from home? Can you guarantee that no one will lose their job for raising that issue?
This is the time to ask everybody, and can I say, from both the evidence, the statistics and the anecdotal feedback we're receiving, the vast majority of our community are doing an outstanding job. We're asking a lot of our community, and it's showing. But the community is responding. And I just want to thank everybody, whether you're an employee or an employer, whether you're someone who's having to homeschool your children, no matter what circumstances people have, everybody is stepping up. And I just urge everybody to continue that because the green shoots are showing. And I'm confident that if we keep at it, if we keep focused on reducing our mobility and especially being conscious of workplaces, and as Dr. Chant said, often it's amongst the workers that it's transmitting and then they're taking it home to their families. Fortunately, patrons are getting the message about getting in and out quickly, but we just ask every workplace, no matter what it is, and a lot of them have to go ahead to keep food on the table for all of us. In workplaces in particular, please think about how you're brushing up against other workers, where you're eating your lunch, where you're having your spare time. All those little things do matter when you have a very contagious disease. And I just thank everybody for stepping up, urge you to continue to do that because the green shoots are there. And I'm convinced that in the next few days we will start seeing, hopefully, more improvements. Who hasn't asked a question, sorry?
Premier, how can you be so certain that construction's going to go back in 2 weeks when you can't give any certainty when school's going to go back or other things?
Because we made an undertaking with the construction sector to say that we need you to work with us, and many of them have been so positive in their feedback. We need to be convinced that all the sites are safe, and that when hundreds and hundreds of people come together, that we know those COVID safety plans in place are the best possible. And that is really important. That goes with any workplace.
But can you make the same undertaking for schools? Why do schools not get that?
Well, we've not said that we're not. I've not said we're not. We are looking at all opportunities.
So schools will go back?
Well, that's why, as you know, in a pandemic, you rely on the information that's coming through. And as we've explained, as Dr. Chan and the Minister and I have explained, often what we see today is what may have happened 5 or 7 days ago, and towards the end of this week we will have a good indication of what July 31 or the Monday, I think it's 2nd of August, looks like. So please know, I know that everybody wants us to have all the answers today, but that wouldn't be an honest way to proceed. What is honest is to say that by the end of this week we will have a much better handle on what July 31 looks like and also what the 2nd of August looks like. But please know, if we do have the opportunity to give parents that certainty, businesses that certainty, workers that certainty, we'll provide that information as soon as we know. But it has to be based on the best health advice.
Premier, will the government have to pay compensation to contractors on government projects as a result of this pause?
I think the public would appreciate that our first focus is on safety and on reducing the transmission and getting us out of this lockdown as soon as possible. And that's what we've been focused on. But we've also been focused on supporting businesses and individuals during this difficult time. And we're going through all the detail of that. But I can't thank enough.
But it'll be in the order of sort of tens of millions of dollars, hundreds of millions of dollars you may have to pay.
I'm not going to put a figure on those things because the real costs are the cost of having this lockdown go for too long. Now, businesses will be hit hard the longer this lockdown goes on. Individuals and families will be hit hard if the lockdown is a protracted one, and that's why we want to get out of this as soon as we can. That's why we're throwing everything at it, but we need your help. We need the community's help. We need all of us to come together to do the right thing so that we can get out of this as quick as we can.
Premier, can you explain why the great...
Sorry, the back row hasn't asked a question
Premier,
yet.
would it be possible, just in regards to schools, and I know this was what we did last year, for maybe children to go back 2 to 3 days a week in 2 weeks' time?
Look, we will be looking at all of those opportunities based on the health advice, and obviously I will say that obviously our priorities are getting the construction sector back on its feet as quickly as possible, but obviously schools, face-to-face learning is great for the students, and it's also great for the parents because they can be more productive at home or whatever they're doing as well, and we know that is really critical. So the government always focuses in those priority areas, and education, face-to-face learning is a priority area for us. And if Dr. Chant tells us it's safe to have face-to-face learning come back on the 2nd of August, we will do that. But I just ask everybody, just please be patient with us. As soon as I have the answers, please know that as soon as we make a decision, we come back at the closest 11 a.m. to tell you, to make sure that people have as much information as they need to provide that level of certainty. We will continue to do that. We're never afraid of making sure that we take decisions in a timely way and then conveying them as soon as we can as well. And that is especially the case when it comes to face-to-face learning. But I do also want to thank our school communities, the principals and teachers, also the education department, the non-government sector, the Catholic and independent schools, who are ready for any contingencies. So they're ready for any decision that we need to take in relation to face-to-face learning, because that means that they can stand up their situations very quickly. And I do want to thank the education sector in general for being so ready to respond to the best health advice. And of course, that best health advice relates to Year 12 students and creating as little disruption for them as possible. And I do want to thank principals and parents for making those concessions to support Year 12 at this time.
On Saturday, you announced that all employers across the state...
Sorry.
On Saturday, you announced that all employers across the state would need to require their employees to work from home in regional New South Wales as well. It sounds like Minister Hazzard has now fixed that issue and made it just based
He has,
Sydney.
yep.
What was the reason by making it employers across the entire state?
I think the intention was to make sure we captured anywhere where the virus was lurking, and that tweak now has made sure that regional businesses have greater certainty.
The infections in the community seem to be remaining quite stubbornly around the high 20s. You mentioned that there are some green shoots that are starting to appear, but does it feel like the numbers just aren't moving at the moment?
Well, no. What we need to focus on, and that's why Dr. Chant and Minister Hazzard and I mention this every day, are workplaces and households. But workplaces, even though we're down to critical things, even though we're down to critical workplaces, that's where the risk is. And the risk there is that people come from a whole different range of suburbs to their workplace, and then they go home to their households. And obviously, for communities with larger households, the impact of the virus is greater, because this is so contagious that if you unfortunately pick it up, you go home, tragically you're going to give it to your most loved ones. And the larger the household, obviously those communities with larger households are more impacted by that fact. And so that's why it's in the strongest terms we say, if you've been asked to get tested, and even if you don't have symptoms, please do that, because it protects you, your work colleagues, but most importantly, it protects your family. And as Dr. Chant said, please don't underestimate the severity of this disease. It is still random in how it affects people. People who are quite healthy in the morning could be on a ventilator by the evening. So it can affect some people extremely quickly. And we need to be aware of that, and that's why we're trying to be as direct and as informative as possible so people understand the risks. It is not like the flu, and unfortunately we're seeing more younger people succumb to this strain than we did in previous strains. So it is a disease affecting as many younger people. In fact, from what I saw, between 40 and 50% of people were under 40, which we'd not seen before in other strains. So please don't underestimate the severity. Please don't underestimate that you could be perfectly well in the morning and then needing intensive care by the evening.
Premier, local council elections are scheduled for September 4. What will be the plan for that if lockdown persists?
No, sure. The local government minister is actually working with the electoral commissioner every day on that issue. So obviously we need to be COVID safe, and it's a bit too early to make a call on that yet.
Real estate agents.
Sorry, the back row hasn't had a chance. Yep.
The tenants union's telling us that real estate agents are still taking out periodic inspections, property valuations, photos for sales campaigns. Is that appropriate under the current lockdown where we're trying to reduce interruptions?
Well, look, there are certain activity can continue so long as it's COVID safe. And that's the issue. We just need to make sure everybody is COVID safe. We understand that some activity can happen completely safely. We just ask people to be considerate and make sure they don't cut corners during this time, because that kind of activity can continue so long as it's done in a very COVID-safe way. One more, sorry, yep.
Just a question for Dr. Chant, if possible.
Yeah, sure,
Sorry.
Dr. Chant.
So just on the number of close contacts, New South Wales Health is juggling at the moment, and then also the amount of support you got from interstate, so you had other contact tracers on board from interstate. Are you able to give us some figures on that?
So in terms of the, I think a small number of people from other states, any assistance we took gratefully when it was offered, just because we want to do everything we can. It was really good. It allows us to do additional discretionary activity. At least allows us to leave no stone unturned. And I think the community would expect us to never reject any assistance that would allow us to move more quickly, more even, and do other things which might give us more further insights into how we can stop the spread. Can I just be very, very clear that this is a time where we can all look at the loopholes and the legislation. And I've got to say, my mind doesn't work like a lawyer, and I've got the privilege to work with many lawyers who have drafted these acts and orders in the middle of the night, throughout the night, and worked. I think what's really important is we convey the intent of the orders. And we individually, as members of the community, have a responsibility to act responsibly. So if you don't need to go and see, while you might be permitted because you might actually have no house to live in, to see a property because you're homeless, is very different than if you can put off seeing a property in a discretionary way because you're just wanting to browse or get in a sense of the property market. I think we all just need to reflect on our own personal individual actions at this time and understand not everything can be dealt with in the orders. When we are drafting orders, we're trying to balance unintended consequences such as not having aged care workers able to work, not having people in logistics companies. You know, it is a very significant juggling act. So rather than focusing on what you can do, my clear message, anything that you don't need to do in the next 2 weeks, including getting, even your eyes checked, if you can delay that for 2 weeks because you haven't got any pain or any other issues, do that. Delay everything that you can possibly do in this next 2 weeks to give us the greatest chance for meaning that you can't come in contact with others. Now, can I be just very clear? My strong advice to government was to close down as many workplaces and settings as possibly can be closed down, all non-essential, and for us to go into the most hardest of lockdown provisions to give us the best chance. Now, obviously that involves construction as well, and clearly a clear advice that construction, we were worried about people working, our southwestern Sydney people often work in construction, in aged care, disability care. Obviously some of those sectors we can't close down. But clearly the principle of the advice is to close down non-essential workplaces because that allows people to stop mixing. Now, can I just also say, in a follow-up to James's question, employers need to think about a few things. One is, do they really want their workplace to be named as a venue of concern? Do they want to actually have their workers contract COVID? And do they want to actually take that COVID back to their household members? Do they actually want to be contributing to that? And we have seen COVID pop up everywhere. So this is another issue for complacency. Whilst we have been very focused on southwestern Sydney for a very good reason, we are seeing unlinked cases pop up. So you can't make assumptions that your workforce only comes from this area or that area. You cannot. The data we've got today reflects what has happened 5 days ago, not what is the risk profile for you now. So I urge any employer that thinks that this is an appropriate action, and I would actually, and I'm not an expert on this, I'd defer to the Minister, but I would see that WorkSafe may well have some investigations to occur if there is workplace transmission and workers and employers haven't done everything they possibly can to allow people to work from home, and really assess the critical nature and deferred any non-urgent work, non-critical work.
Doctor, may I ask very quickly, the South Australian gentleman?
My question was, how many close contacts is New South Wales Health dealing with? Do you have a number? And how many people came in to support from interstate the contact tracers?
No one came in from interstate. They basically conducted case interviews. It's a small number, I would say less than 20. We've got many contact tracers, but as I said, I think the community would expect us to use every assistance possible, and often if they had particular skills that we needed.
The number of close contacts? I'm really sorry, just the number of close contacts.
Can I just answer your question? Because I did answer it yesterday as well, because there was some... Sorry?
I wasn't here yesterday, sorry.
No, that's all right. I'm sorry if you weren't here. Well, actually, you're lucky you weren't here. You were. Can I just say that... Sorry? Can I just say that there's about... I asked yesterday how many tracers and interviewers we had, and they've stood up nearly 550 at the moment. And we have had some very kind offers from other states as we made to them when they were having their challenges. I think WA offered us 5, and we're grateful for that, and we're grateful. but we actually have a huge number of people currently doing case interviews and doing the tracing. So, but every little bit helps when you've got obviously the challenges we've currently got.
I hate to be a pest on this. I hate to be a pest.
Sorry.
I really hate to be a pest on this, but how many close contacts is New South Wales Health dealing
Can
with?
Dr. Chant make that available to you a bit later?
Okay,
Nurses are telling us that they can't get to work on time because of the Sunday timetable. Is there any way that it can be ramped back up?
Look, I think I spoke to the Transport Minister this morning and he said they were actually reviewing all those situations, so they're going to try to make sure that there were adequate numbers. Obviously, one of the issues, which I think has been missed in it again, is that there were quite a number of people who come out of southwest Sydney who would normally be driving public transport. So obviously public transport are following the instructions from Dr. Chant to try and minimise having people come out of that area, but also just mobility. But yeah, it's being looked at. Sorry, Sarah.
There's a new case in Cootamundra we've been informed of, if we can address that. I understand there's a visit.
How about we make that the final one for today, and perhaps Dr. Chant can...
We just want to know whether the visit to the private residence was legitimate and what the exposure is like to that community this time.
We will be providing an update. We are just trying to get... Sorry. We are currently... I can confirm that we do have a case that has been diagnosed associated with the exposure of the truck driver, and we're just currently urgently assessing the situation, but we will be releasing advice. There was someone who was a known close contact who's been in isolation, but as you're aware, we just assessed whether there were any exposure venues in the Carboni, Orange, Blaney and maybe Bathurst, and we're just assessing those issues. We'll release the advice about those venues. We're just confirming the period of infection. The gentleman was in isolation when tested, but we're just going back to look at whether he was infectious in community. That information will be released, and any further requests for that community will be made as soon as possible.
Thank you.